Hi everyone! So today we are going to be dissecting your cats, and biggest difference is my cat clearly has the skin taken off. So I went ahead and took all the skin and all the hair off for the purpose of this video, and you guys are going to have to take some time during lab to get the skin off as well. Also, these cats are preserved, so they are in a solution that can be toxic to you. So we ask that you always wear gloves, please. And it is not required, but you guys can wear goggles if you would like to have them. But once again, it is not required. So we get these cats from a company called Carolina Biological, and it is their solution that these cats are preserved in. So if you really want to go and look up what is actually in this preservative, you are more than welcome to. Okay, first things first, we need to talk a little bit about directions on the cat. I'm sure you guys have probably heard of anterior, posterior, inferior, and superior, and that's what we use in people for two-legged animals or people. And when we come to we have four legs in the cat, we have to have different terminology. So we have ventral, which is the stomach side of this cat. We have dorsal, which is the back side. And we have medial and lateral next. So these cats, we have what we call this midline, going obviously down the middle of the cat. So a medial would be going towards that midline, and lateral is going to be going away from that midline, so away from the midline. And then we have proximal and distal. So proximal is usually used when we're talking about the limbs. So if we're going distal, we are going to be creating more distance from the joint, so going away. And then proximal is going to be the opposite, going back towards, so it's closer. And then we have cranial and caudal. So obviously, hopefully you guys know what cranial is. Cranium, the head. So cranial is going to be going towards that head. Caudal, going towards the caudal vertebrae. And then we have, when we're talking about this part of the cat right here on the foot, we have palmar, just like your palm of your hand. So palmar, and then on the back side, dorsal, once again. And then when we go to the foot, we have a plantar, which I don't know if you guys, hopefully you haven't ever had a plantar wart, but they're usually on the bottom of your feet. So palmar, and then dorsal once again on the back side of that. And then also when we are talking about right and left, it's always the cat's right and the cat's left. It's never, if you're facing the animal to your right, your left is their right, and it's always the cat's right, the cat's left. And then lastly, we can talk about, you cannot get any more cranial than the head itself. So we have to have some directions on the head. We have rostral, which is sounds like nostril, so going towards the nose of the cat. And then we have caudal, which is going away from the nose on the cat. Okay, so that should be it, which you guys will go over these in lab. Once again, you'll go over with us, the TAs, so that you are positive of which direction is which. And so no worries about that. You'll definitely get those down in lab. Okay, so we are moving on to the actual dissection of our cats. So first of all, when you're actually, hopefully you guys can see this a little better. Okay, when you're actually dissecting the cat in lab, I suggest that you go ahead and play this video. It's going to be posted on Canvas. And so hopefully you guys will play this video during lab so that you can actually, this will help you get through the dissection of your cat. First things first, when you're using a scalpel, always cut away from you. Never cut towards you. Cut away from you. Okay, so we are going to cut from sternum to stem. And I'm going to start out just cutting a line from up here, getting that first initial cut, going right down the midline of the cat. And it's going to be, you can obviously hear up here, it's going to be a little harder because we have the ribs. And then when we get to the abdominal cavity, we want to be a little more gentle. So we want to favor this ventral side so that we aren't cutting into anything important down here. And sometimes it's easier, especially in this bottom, if you actually can pick up the skin and cut it that way. That way you're not actually touching any of the abdominal cavity with your scalpel. Okay, so we get into the abdominal cavity here, and there is going to be quite a few, some nice, oh, looks like had a little bit of blowout in the stomach. So you're going to have some juices. If you guys ever, if it ever gets too much, you can just kind of dump your cat out. And you're going to encounter that probably a lot. Okay, so next, to actually cut up here in the sternum, I'm going to take my scissors and actually use the scissors, hopefully you guys don't mind bone crunching, to actually cut up here into these bones. Okay, you guys are going to see there's quite a bit of good stuff in here. And I want to be very careful when I'm cutting up here so that I don't cut any arteries or veins that we have up here in the neck. So be pretty careful up here. Okay, so got these separated. I'm going to dump my cat out here again, get some of that fluid out. Okay. And then what I want you to do is we want to save this abdominal cavity, but to actually, in order to open up these cats, we're going to cut just little flaps here on the side so that you can kind of open up this cavity a little better. Okay, there we go. And it looks like a good chunk of dye there. Okay, you also are going to want to cut the diaphragm a little bit so that you can actually open up the cat. Okay. And a lot of this also today is going to be kind of cleaning up some of this good stuff that's in your cats. Get that opened up pretty good. There you go. Now you guys are able to see the whole abdominal cavity and the thoracic cavity. Okay, so let's talk a little bit about, you guys are probably seeing that everything is very blue and red. There's lots of, looks like bright colors in here. So these cats, when they are preserved, they're also injected with a plastic dye. So all of the arteries are injected with a pink dye so that you're able to identify them easier. So that's really awesome. And then all of our blue is going to be our veins. So then it's a lot easier to see these arteries and veins if they're injected with this dye. I can zoom in just a little bit so you can see. And you can already see up here on the neck where that dye was injected. Okay. So also when you're doing these, you can see I'm using a lot of my fingers for a lot of this stuff. You want to try and preserve as much of the tissue as you can. So using blunt dissection, so taking your scissors and going in and then opening them up. So you're sticking your scissors in and then you're opening them up. Sticking them in, opening them up. Or I'm using my fingers a lot. So you can see that my fingers actually will help melt away a lot of this tissue. And that will help not destroy any of the structure. So here's a big, nice vein here for you. That's going to be your cranial vena cava. Okay, so if we get down a little bit closer, we will start to see some structures. So just like on this side, hopefully my fingers aren't covering it up too much. A lot on this side. I'm going to take my scissors, do some a little bit of blunt dissection here and clean up some of this stuff. Okay. Okay, so I have this pretty well exposed here, so you guys can see a lot of this good stuff in this cat. Okay, so now we can start going through and we can start identifying structures. So like I said, up here at the top, you can see some bright red and bright blue structures. Move my hand out of the way. So we have this big vein that's right here. That's going to be our cranial vena cava. So vena cava meaning vein. That's this big one that's right here. So on top of that, we can see this ring-like structure up here. This is our trachea. And I shouldn't say they're ring-like, but they're more like C-shaped. So the trachea is what's bringing air into our lungs. So it has to have a pretty rigid structure so that it's able to go against that negative pressure and stay. If the rings weren't there, basically it would just collapse. And so then right next to that, clean up some of this stuff here, is we're going to have the esophagus. So this structure right next to the trachea, usually just right to the left of it, is going to be our esophagus. So that's just right to the left. And then right next to these, you will have two on each side. So just on both sides of our trachea and esophagus, we have a major artery here that is called the carotid. So you'll have one on each side. And then if we feel up on our trachea, just cranial on the trachea, that's what we have, we call our larynx. So if you follow your finger along this trachea right up to the top, that gets kind of hard and smooth right there, that's our larynx. Okay, so like I said, you guys have definitely been able to see this cranial vena cava. Right here, and this is going to come down into the right atrium of the heart. And then if I can clean it up just a little bit more, down here, this is our caudal vena cava. So the caudal and the cranial vena cava are going to meet right here at the right atrium of the heart, which when we dissect the heart, you'll be able to see that a little bit better. And then we actually move onto our heart. So this structure right here in the middle, there's our heart. And there is a structure that goes around the heart. It's called the pericardium. And basically what this does, there's little blood vessels and veins that go around there. And I don't know if you guys know Latin, but pericardium actually is Latin for the heart. Okay, so you have a pericardium that goes around the heart, and you guys will be able to take that off. I'll dump some more of my fluid out a little bit. Okay, and then right around the heart is our lungs. So you can see that these lungs have they're lobed lungs. So it's not just a big sac of air, but we have several lobes that actually go around the heart. And you guys are going to be seeing a lot of, if any of you have ever taken the meats class or anything, you hear them talk a lot about kpH. And so a lot of this kidney pelvic heart fat is what I'm kind of taking out here and putting on the side just to clean things up. So there's quite a bit of that covering. This cat actually is really not too fat, so she doesn't have a lot, but she definitely has some that are around the heart and the lungs. Okay, and then we will talk a little bit moving down. So here's our diaphragm. So this muscle, show you on this side, separates our abdominal thoracic cavity, and it's a big muscle that really helps a lot with breathing. And then we move on. So this whole big structure right here, that is the liver. So you guys can see that it's also very lobed. And then if we can go into the liver just a little bit, here's what we call the gallbladder. So you kind of have to dig a little bit when you go into the kidney, or the liver. The gallbladder kind of sits in one of those big lobes. And the liver does a lot of filtering blood, and it filters a lot of the blood that comes from the digestive system. So you actually have the portal vein, which is coming, this one's actually not dyed, but it's coming from the small intestines into the liver. So right here by my finger, there's the portal vein, and it's carrying all the nutrients and all the good stuff from your intestines into your liver. And then we have our stomach over here on the side, and unfortunately our stomach kind of had a little bit of a blowout, so we have some kind of food stuff coming out of it. But here's our stomach right here on the side. This cat definitely has a full stomach, so I'm gonna take some of that out a little bit. And then we're going to move on to this good stuff that's actually covering the small intestines. You guys are probably like, what in the heck is that? So this is called the omentum. And you guys really want to try to keep this intact. So you can just kind of lay it over when you go over it, and when you go and you start looking at the small intestines and large intestines. So this omentum is actually only attached up here at the stomach, and it kind of serves as a little bit of protection, and it goes around the small intestine. It also can act as a lymph system. So if you have something that pokes through the small intestine or something like that, then that actually can help a little bit with those sorts of situations. Okay, so now we're going to move on to the small intestines. That's what all of these are right here. All of these are the small intestines. And then we're going to see all of this stuff that's in between the small intestines. So this is called the mesentery. Don't get this mixed up with the omentum. Omentum is up here. The mesentery is what actually attaches the small intestine to the abdominal wall. And you're also going to see you should be able to see the mesenteric arteries and veins in that mesentery as well. Okay, so then we are going to move on to our spleen over here. So it's this darker colored structure right here. And the cats, they're pretty large. Last year we used rabbits, and last semester we used rabbits, and their spleens were quite significantly smaller than the cats. So we have a big spleen right here. And then just to the right, because you know, cat's right, we're gonna have our pancreas. So the pancreas is this light colored structure right here. And a lot of people say that it looks like brisket, which, you know, if you want to think about food when you're dissecting a dead cat, that's fine. But we have our pancreas right here. And really this pancreas, it ends, or actually maybe starts, right here where the stomach and the small intestine attach, or where the food is going to be coming from the stomach into the small intestine. That's where that pancreas is going to be. Because obviously it's going to produce insulin and some other digestive enzymes that you're going to need in the small intestine. Okay, so like I said, we have our small intestine here. And then also we have our large intestine and or colon. So that's going to be the last part of our digestive tract. So it's kind of this larger structure here that's then going to have all of the food stuff exit the body. So here's the back or the bottom part of that colon. Okay, so then, and if you guys can see it, you can find a little hook in your large intestine. That's actually what the cecum is. And in people, that's what our appendix is. So you have this little hook right there. Okay, so now we're gonna move on to our kidneys. And the kidneys are actually gonna be in somewhat of a little capsule. So you're gonna have to kind of clean that up to actually get that kidney out. So they're gonna be, you can see that there's a little bit of tissue surrounding that kidney. So you're gonna have to kind of clean that up to be able to actually see the kidney. And then right next to the kidney, going into the kidney, we're gonna have, you can see this big blue vein. There's our renal vein. And the renal artery should be right next to it. It's just a lot smaller. Also, with this big blue vein that's coming down here, this is also continuation of that caudal vena cava. So the caudal vena cava is going to be bringing blood to the heart from this bottom half of the body. So it's a large vein. And then right next to it, I can clean this up a little bit, we're going to have another major artery that's going to be supplying blood to the bottom half of the body. So this is our aorta artery. And it's an artery that runs, this is once again supplying blood to the whole bottom half of the body. So you can always tell these are the two big ones. You have your caudal vena cava, and the aorta will lay right next to it. Okay, and you guys are probably gonna be confused. These over here on the side, this is a female cat actually, so these are going to be the reproductive organs of the cat over here on the side. You can see them on both sides. Okay, thanks guys for watching. If you have any questions, please bring them to lab and we can show you in lab. And I will see you guys this week. Thanks.